Hi, everyone. My name is Megan Collins. I'm the research coordinator for CureGRIN, and today I am joined by Dr. Ian Coombs, who is at the University College London in England in the Neuroscience, Physiology, and Pharmacology department. Welcome, Dr. Coombs.
Hi.
So we'll get started here, and our first question is, what are the key takeaways from your research?
Well, over the last 15 years, we've looked at how AMPA receptors behave and also how they behave in the context of the crucial auxiliary subunits that are also present. So they're normally the center of a protein complex. And by understanding more about these particular combinations, we can understand more about how glutamate receptors behave in the brain. More recently, we've done certain pharmacological studies on AMPA receptor drugs, and these are both established drugs in the clinic, but also drugs that are currently in development, and trying to understand their mechanisms of action and how they might modulate AMPA receptors in the brain. And all of this has come together recently with our work with CureGRIN, where we've identified the altered properties of AMPA receptors in patients with GRIA disorder, and shown how drugs can modulate those receptors. And I think we believe and we've shown that if we can understand the functional changes caused by a particular genetic variant, we can understand more about the disease and ultimately target the disease with the best drugs.
Thank you for that. Such important work. Our next question is, what questions will your research help answer about GRIA disorders?
Well, the questions that we're working on, you could think of them as both on the small and the large scale. So in terms of the small scale, we are still keen on engaging with CureGRIN, engaging with the forum, getting direct information direct from patient families about particular GRIA patients with GRIA disorder, and to identify the properties of those receptors affected by that particular variant on a case-by-case basis. And so by doing this, we can help to build up our understanding of how these, obviously how these variants affect AMPA receptor function, but also more broadly to try and understand how patient symptoms are reflective of the properties of the AMPA receptors that have been changed. And by doing this, ultimately, we'd like to be in a situation where, because these are time-consuming experiments, and so if a patient is identified as having, let's say, a GRIA2 variant, it takes a long time to do the experiments we do to find out the answer. So if we can more quickly say, okay, this patient has a GRIA2 variant and has these symptoms, we can look back at the work we've done to try and work out whether this is likely to be loss of gain of function, and to help advise clinicians on the best treatment.
Thank you.
Okay, and then sorry, on a larger scale, sorry, that was we're kind of looking at the use of new interventions in cases of GRIA disorder, and these would be identifying new drugs that can potentially help patients. So we've identified an established drug, perampanel, as being potentially of benefit in patients with gain of function variant. We're also interested to see if there are any AMPA receptor potentiators that could be useful in cases of GRIA loss of function.
And what would you say you are most excited about for your lab in the future?
Well, I mean, we're really excited to continue working with CureGRIN. So this is both performing experiments that, from the interactions we've had with individual patient families, and also kind of engaging with the meetings, and I mean, hopefully publishing some useful papers as well. So the paper we published as a direct result of our interaction with CureGRIN has been viewed a whole bunch of times. We've been contacted by clinicians, by patients with other GRIA disorders interested in finding out more. And so hopefully that will be finally published within the next month or so. Ultimately, we're hoping to provide the foundation for future therapies for new classes of GRIA disorders that currently don't have a precision therapy, and even moving forward into some classes of gene therapy, which will hopefully more directly address the individual patients, the individual genetic diseases, And hopefully we can actually help design something that is more broadly useful as well for a range of diseases. And the more broadly applicable the thing we create can be, the more likely it is to ultimately get the funding and to actually be propelled forward into being a viable treatment. So.
Thank you so much, Dr. Coombs. We really appreciate all the work that you're doing and your collaboration with CureGRIN. And I'm sure our families are excited to learn more about your work. And we thank you so much for your time.
Okay, thank you very much. Thanks.